live and direct from anywhere in the world. It's The Kelly Show with Dr. Kelly Mondesire.
Hello and welcome back to The Kelly Show, real people with real stories in real time. And of course, I am Dr. Kelly Mondesire, creator, executive producer, and hostess with the mostest. And we're kicking off February, the month of love, relationships, and everything to do with the heart. And I'll tell you a story. Way back in the day, once upon a time, a long time ago, in my radio days, I worked with Dr. Ruth Westheimer, who was the groundbreaker for sex therapy and bringing to national and international attention relationships, sex therapy, and I used to call her Ruthie. She was an amazing woman, and she would little tiny, maybe 4'6", 4'7", would run into the studio every Wednesday afternoon and say, "Hello, everybody," and she would do her show. And on her way out after doing her Wednesday afternoon show, I believe it aired on Friday evenings. It was WYNY Radio FM in New York. She would say on her way out, "Goodbye, everybody. Good sex, everybody." She was brilliant. And all of us owe quite a bit to Dr. Ruth Westheimer. So thank you, Ruth, for everything you did. However, today I have an incredible guest. She is an internationally renowned clinical psychologist, sex and relationship therapist. And she has been so gracious to come to the studio today and talk about relationships, sex therapy. And I'm going to introduce her and bring her into the studio after a word from our sponsor. So we'll be right back. Stay tuned.
This portion of The Kelly Show is being brought to you by the Runway 28 Beverage Company, makers of premium pink Irish vodka infused with mixed berries. Please drink responsibly.
Welcome back. And okay, so I need to read this bio because it's a very special guest I have on today. Dr. Megan Fleming, brilliant, beautiful, and good friend of mine, is a licensed clinical psychologist and internationally recognized sex and relationship therapist. She is a certified diplomate in sex therapy through ASECT and Imago Couples Therapy. Dr. Fleming is also a clinical instructor at Weill Cornell Medical College, New York Presbyterian Hospital. She is the founder and former director of the Sexual Health and Rehabilitation Program at Beth Israel Medical Center, also in New York City. And in private practice, Dr. Fleming has 25 years of experience working with individuals and couples to break through what's holding them back in and out of the bedroom. Known for her practical advice and easy to follow guidance, Dr. Fleming is a sought-after speaker and media go-to expert for all aspects of sex and relationships. Dr. Megan Fleming has been featured on Anderson Cooper, Oprah Winfrey Network, MSNBC, Cosmopolitan, Men's Health, Women's Health, Maxim, and the New York Times, amongst others. It is a great privilege and honor and pleasure to welcome Dr. Megan Fleming. Megan, how are you?
I'm fabulous. Thank you so much for the amazing introduction. And interestingly enough, Dr. Ruth actually trained at the same human sexuality program that I run in a clinic in a medical college in America. So,
wow. Well, tribute to Ruthie, as I used to call her. She was an amazing person. However, you are an amazing person as well. So let's get to it. Tell me first, where are you from and where are you now in the world?
Sure. I'm from Maryland, Towson, Maryland, and I currently live in Lower Manhattan, New York City.
Okay. And we were neighbors for many, many years in Wall Street. And yeah, lots of fun stories, lots of history that we have. So tell me, how did you get into clinical psychology and how did you wind into the path of sex and relationship therapy. Tell me all about it, please.
Sure. I mean, it was a bit of a winding road, as often life can be. So I did my PhD program at what was Hahnemann, now part of Drexel. And I came to New York City, New York Hospital at the time, New York Presbyterian now, for my internship. And I was really fortunate that the human sexuality program that I mentioned earlier that Dr. Ruth went to, I also got to be part of that training class. So Helen Singer Kaplan, she's the one who started that program. She's also the one who added the desire phase to the sexual response cycle, which, most people give credit to Masters and Johnson. But Helen really was very instrumental in how we think about sexuality and sort of treating sexual dysfunctions. And so from there, actually, I was also training at Sloan Kettering because I was very much interested in health psychology at once. I feel like I have multiple careers. At one point, I was in pain medicine and palliative care. And so at Sloan, I really worked a lot with breast cancer and prostate cancer survivors. And for me, it was such a unique opportunity. They go through so many losses relative to treatment and just the impact of cancer on their quality of life. And so adding the sexuality piece and resuming intimacy, post-treatment and after cancer, to me was such a rewarding part of the work. In fact, one of the stories I remember, because I would do workshops at like Share and Gilda's Club, there was a very young woman who had early breast cancer and went through basically premature menopause, and so she really wasn't even identifying as a female, didn't even understand, because she was no longer able to have children. From her culture and perspective, it was like she didn't have any worth. And so, it was a huge opportunity to really work with that woman and other women who really didn't necessarily even know the options that were in front of them. And I think importantly, when it comes to medical illness and sexuality, there's so many things that impact our sexual function, but that doesn't equal the not a lot of treatment opportunities and, things that we can do to really bring back pleasure.
I concur with that. I was trained out of Sloan myself, and I would have many female and male patients, both breast and prostate cancer, that would have difficulty with sexual identity, taking off their garments to be intimate. And actually, I remember referring quite a number of patients over to you because they needed your help. And thank goodness, some of them did reach out to you on that level. So how did you transition from Sloan Kettering into your niche expertise?
So from Sloan, I initially was an attending at Beth Israel, where I started the sexual health and rehabilitation program while I was in pain medicine and palliative care. And I really enjoyed creating a multidisciplinary program where it was like urology, gynecology, oncology. However, I was only there a few years, and then I went into private practice. And I would say in that regard, my sort of practice really transitioned from predominantly around medical illness to, everyday, individuals and couples with the challenges that many of us have, navigating relationships, and importantly, specifically long-term committed relationships, right? How do we sort of keep the eroticism, the sexual connection, the vitality sort of alive?
Okay, and I believe your office is in the West Village of Manhattan. Is that true? Yeah. Okay. All right. And let me ask you this: what is the typical demographic that you see in your private practice? Who are the people that actually come to you to seek help? And is it typically, we have all different types of relationships these days. So I'll keep that question open for you to educate all of us.
Sure. I mean, one thing I would say is just like, I really was fortunate to get the referrals from you. It's not uncommon, whether it's a urologist, a gynecologist, people get referrals. And it's almost like the sex therapist is the last person somebody wants to call. So it's not uncommon, the provider might make that recommendation 2 or 3 times, potentially even over years. And what I often say to anybody listening is that, seeing a sex therapist, I almost say it's almost like suicidal ideation. It's the thing that people don't want to talk about. But when you find that place and that safe container where it's like, oh, I can talk about this, it's such a huge relief and gives, so much hope and sense of possibility. So when and if anybody listening, I really would like to take the stigma that unfortunately often exists around sex therapy and sometimes even therapy. But I really did get the range from everything in the, early 20s all the way probably into the 70s and sort of everything in the middle.
Okay. And what types of issues do your clients approach you with?
So they're either predominantly focused more on the relationship challenges or on their sexuality. On the sexuality side, predominantly I see what we sort of refer to the sexual dysfunction. So it's difficulties with whether it's orgasm, desire, if we're thinking the sexual response, desire, arousal, and or orgasm. So that could look like little or no sexual desire. That can manifest in mismatch or desire discrepancies between partners. That can lead to sexless relationships. On the arousal, often we also see anxiety because people so much want to please their partners. Whether it's anticipatory anxiety or performance anxiety, that can lead to premature ejaculation, erectile dysfunction, delayed ejaculation, inability to have orgasm. So like the whole sort of breadth of how the sexual response cycle gets impacted. And again, sometimes it's anxiety, which is often, but it could be also medical aspects, whether it's neurological, endocrine, vascular. So really helping people make sense of, wait, what just happened? How do I make sense of what's happened? And also, what have I not yet tried?
Got it. And as you and I know, social cultural backgrounds contribute to what a person brings into a relationship. However, what in your experience prevents, or how do you enable a client who has experienced sexual abuse in childhood or vis-a-vis past relationships to either make those breakthroughs? Perhaps they've never told their significant other about that abuse. How does that play into a relationship? And how can you, or how do you bring those couples together to talk about it so that that one person who has the PTSD of the abuse, bring it to the table in a way that it can be shared and taken in, appreciated by the significant other, and they can move forward in the relationship? Because we know that blocks a lot of people.
For sure. I mean, that's a specific kind of sexual trauma, but trauma in general can impact sort of our feeling of emotional safety. And our ability, again, arousal, the foundation of it is relaxation. So for anybody who's got sort of a trauma history, it's not uncommon sort of survival strategies, right? That their nervous system is, the antithesis of relax. It's really holding a lot of tension. So, I guess I would say, first of all, has that person done, sometimes I'm working individually, and then ideally, to your point, we bring the partner in. But it's ultimately about essentially rewiring, reconditioning the nervous system. First of all, first and foremost, to feel the safety and knowing that, and generally we take penetrative sex off the table because, again, how do you relax? Part of relaxing is knowing you're not anticipating what's about to happen, what you think should happen, just finding a partner, feeling that pressure. And again, it's working really slow with the body somatically to foster like feeling touch. And it could even be like a hand massage. We really want to figure out even just the thought, does that create the tension and the anxiety? All the way to, almost creating a hierarchy. We sort of refer to it as like systematic desensitization, that recognizing how do we allow a little bit of anxiety? We can breathe through it, we work through it, and we, ultimately are working with the body to know that it's safe and can let go so that sensations that can feel pleasure can come online.
And let me ask you this, because we have a society now where love is love, and everyone can, we hope, be free to love whoever they want to be in a relationship. We hope, because everyone is entitled to be at peace and a happy life. Are you now working with more transgender individuals, and what are those challenges? Well, some of the challenges that they deal with now in relationships.
Well, I would say I predominantly work more with people who are in different sexual orientations, including things like consensual non-monogamy, than in my practice transgendered. But I can certainly say that, you know, it's complicated. I mean, on one hand, there are way more services and community and opportunities for them to find partners. On the other hand, there's, you know, always been the stigma, the bias, the hostility, all the factors that can unfortunately impact one's sense of self-esteem, but also can lead to greater mental health challenges. And I would say that that is particularly true of amongst transgendered individuals. So although they have more options and I think ability to create relationships and community, it's also true that they are a community that really does need a lot more resources and support, because they often don't come from places or communities that offer or provide that for them. And so I would sort of say that they, you know, it's a mixed bag in that regard, right? Like more opportunities and more challenges.
Yeah, I can imagine. But aside from your private practice, we have a slide. If Gareth, you could put up this slide. All right, Dr. Megan, tell me, what is, it looks like she and Pleasure Chest. Can you tell me what's going on the side, and what is Pleasure Chest? Do tell.
Well, so the Pleasure Chest happens to be the sponsor of SHE, which was the Sexual Health Expo in New York City. And so the Pleasure Chest is, it's a fun sex toy company. It's a place that exists here in New York City, just like Babeland. So again, it's a sex positive and an opportunity for people to think about what are products and that can enhance sexual pleasure. So they were the sponsor for this. This is my talk. It was Great Life, Great Sex, which is also my website, because I certainly think that you know, everybody gets to define as their own expert what is their version of a great life with great sex. But I do think sex and sexuality is an important aspect of our vitality and our aliveness. And so it's something that I'm really interested in helping people sort of know and own throughout the lifespan.
Okay. And let me ask you, what are your thoughts on sexuality today, such as like gender identity, gender change? What do you and your colleagues, what are your thoughts about this globally? There's a lot going on globally. Some countries are banning homosexuality. There's a pushback on sexuality in general. What are your thoughts about all this, if you would like to share?
Well, I think it's really complicated, because even within some of the organizations, like the QUAD, the Scientific Study for Sexuality and Sex Therapy, that, you know, it's complicated, because again, if we're going back to the transgender, we're looking at what age, you know, really where is that line, in a sense, where someone can sort of consent. And I think, as you just sort of said, across the world, there are certain places where there's more support, and then there's other places where it's denounced, or people could literally get killed for expressing or even identifying, not just identity, even sexual orientation. And so, you know, honestly, it's not my strongest area of expertise to comment on, because that's not the bulk of the work that I do. But I'm certainly mindful that, as I think I said earlier, it's like that mixed bag. It's both like there's more opportunities, but also depending where you live and the communities that you're in, there's also more reason to be afraid and to potentially essentially not come out and or own the exploration of one's own sexual identity.
Yeah, I agree with you. It is complicated. Yeah, we'll leave it at that. Now, let me ask you, where do you see yourself 5 to 10 years from now? Do you see yourself still doing what you're doing, or do you have any future projects? I know you're so involved internationally. What's on the table for you?
Well, I've more recently really begun to love doing intensives, because specifically when I'm working with individuals or couples, sort of the traditional model is, after assessment, typically like 45 minutes to an hour every week, every other week. And I don't think that really helps, like, in a deeper way, get to sort of the heart of the matter and helping people understand and make sense of, again, because a lot of these things are tied to relationship dynamics. So whether it's 4 hours or up to 2 days, I find that working in an intensive way, starting with even the psychoeducation of, like, how did we end up here? How do we make sense of this current, where we are, and the impact that it's had both on our feeling of connection, but also our physical intimacy. So I really think that working longer and deeper is sort of, for me, the movement of the future. I've also begun to incorporate ketamine, which is used, there's a lot of talk about psychedelics these days. Unfortunately, they're not legal in most places. And so as a licensed clinical psychologist, ketamine is, I don't prescribe it, but it is a legal drug. It's an off-label use that, with Journey Clinical is the organization that I'm affiliated with. I basically help with the integration, because it can be used either psychedelically, a very dissociative experience, and or psycholytically, which is a lower dose that when I'm working with couples, it's a way of kind of bringing down some of those protective parts, those adaptive strategies, those defenses, so that there can be more sort of an openness, and I can feel like that I can really help them sort of shift and create a deeper level of connection. So I am interested ultimately, and I think internationally, globally, like doing retreats, and both for individuals, but also for groups in a group setting, really creating that safe container so that people can sort of explore their blocks and barriers to, what's really getting in the way of them having the sex and the relationships, that their hearts desire.
Now, we have a global audience on the Kelly Show. So my next question is, if a viewer would like to reach out to you and might be, say, in, for example, Madagascar, are you able to, with your licensure, be able to help them, or are there limitations to who in the world globally you can help and treat? How's it work?
Globally, I'm working more in a coaching capacity, and certainly within the States, in a therapeutic capacity, I'm only allowed to work with people in the state of New York. But I certainly have clients that I work with internationally, everywhere from, Israel or India, like, across the globe. So anyway, if they want to reach out, they can reach me through my website, greatlifegreatsex.com, and there's sort of a contact information there. But again,
we're going to put that up. But yeah, for viewers out there all over the world, know that you can reach out to Dr. Megan Fleming, and we're going to put that up shortly so they can grab that information and reach out to you. So we have. Sorry.
As a resource to anybody, that ASACT, which is the American Association of Sex Educators, Counselors, and Therapists, by state, they will tell you who's qualified. So again, for anybody listening who's in the United States, if they want to find somebody in their area, I would go through ASACT.
Oh, okay. Thank you. Thank you for that. And apologies for interrupting you, Megan. So we have a tradition on the Kelly Show where I ask each and every one of my guests if you could name one person, place, thing, or experience that you're grateful or thankful for, who or what would it be? And I think we have a slide.
So this is Dave, who because this is on the balcony of the building that we both have lived at, and I still live. We will be this year married 25 years, together almost 30. And I can tell you that, marriage is what an opportunity for learning and growth. Sort of the mirror that I think we all need, and recognizing monogamy doesn't equal monotony, right? Like the grass isn't greener on the other side, it's where we water it. So in a relationship, really learning how you can push each other's growth edges, both in challenging and complicated ways, but also in ways that maybe you couldn't have even imagined. Because I think, again, vitality is a bit about taking risks, feeling safety to take risks, and, sort of explore things out of your comfort zone. And I think relationships are an amazing opportunity for growth and really to feel fully alive.
Well, I've known you and Dave and your children for almost 20 years. Honestly, you and Dave and your children are the most amazing family. The love that you have for one another, your children who aren't kids anymore, they're not little, there's the most well-rounded, polite individuals, young adults I know. And you and Dave are just so together as a couple. It's really a beacon, and maybe there's hope for me. But anyway, okay, still looking for the nice single straight guy, so send them my way, Megan. But anyhow, folks, viewers, if you would like to reach out to Dr. Megan Fleming, we have her contact information up here. Do take down this information. Please share this episode with your friends and your contacts, because you never know who needs her help. She is kind, the best at what she does. I highly recommend Dr. Megan Fleming. Her contact information is here. Write it down, take a photo, share this episode. This is a lot of great information that you're getting gratis from Dr. Megan Fleming. So Megan, I want to thank you so much for coming on to my show. I want to wish you a wonderful February, month of love, sex, and relationships. And if you and Dave come down south, you can always stay with me. You're always welcome at my door. And thank you once again. And so, folks, if you would like to be on The Kelly Show, please contact us. We have the information here. See, write in, tell us where in the world you are, who you are, what your story is, and why you would like to be a future guest on The Kelly Show. And don't forget to subscribe today. Contact information here. Subscribe today to The Kelly Show. We've got a boatload of past episodes, many more to come. This is the month of love, relationships, and everything of the heart. And stay tuned for next week when my special guest is going to talk about cardiac nutrition and why what you put in your mouth is so important for your heart, your body, your mind, and your soul. So stay tuned for next week. So for now, peace and love. Gareth, take it away.
If you would like to be a guest on The Kelly Show, send us an email with your contact information, where in the world you are, and a brief description of the story you'd like to share today.